I think you've given us clarity on masks, clarity on one more issue, Dr. Swaminathan, which is vaccinations. The WHO has been saying vaccinate, vaccinate, vaccinate. What are we finding in India? Actually, vaccinations have come down in the last month. There's a shortage of vaccines. What is your, what is that the way out now, that we just have to vaccinate much more in the next few months? And how do you see the Indian challenge given the size of our population? Because at present rate, it could take anything from 2 to even by some estimates, 10 years to give everyone double dose across 100 billion people. So 100 billion people. So how do you see, what do you see the role of vaccinations? What will WHO do to help India speeden up this vaccination process? Is that our big failure?
No, it's a global problem, and we've been crying ourselves hoarse about vaccine equity around the world. There are countries which are much worse off than India, Rajdeep. I think we have huge advantages in that we have these manufacturers that have been over the years supplying the world with vaccines and are rising to the occasion now. So I think we are in a and we should be proud of what we have in India in terms of the vaccine manufacturing capacity. The situation obviously today is that you cannot have enough supplies for the demand. It is taking time for manufacturers to ramp up and scale up their production enough. And remember, vaccines are being given to people who are healthy. So we need to make sure that the safety and the quality and the manufacturing quality are maintained. We cannot rush into vaccine production that might actually result in some things that we don't want. So they need the time and investment. Many countries put lots of money into. India has also now invested in expanding manufacturing of a couple of. So over time, we'll see the supplies going up. Today, we have a situation where demand outstrips supplies. As I said, globally, there are African countries which have not even vaccinated their frontline workers and health workers. At least in India, I believe over 80-90% of our healthcare workers are vaccinated, and about 45%, I think, of our over 60-year-olds. But overall, population-wise, yes, only 2% have received 2 doses, 10% 1 dose, and we know that's not fully protective, could be partially protected. It is going to take time. I mean, there is no shortcut. The vaccines have to be manufactured, then they have to be distributed, and then they have to go into people's arms. And it takes a couple of months for people to get the 2 doses and to get the immunity. So, yes, vaccines are, the long-term, I think, solution out of this pandemic, but not for several months, or maybe even we can talk about years. And that's why we need to prepare for all the other things we need to do in the meantime as we scale up vaccination.